Medicalchain is the ambition of a decentralized healthcare system. Hello from Fabio Ferentini. Welcome to the new video on blockchain for healthcare, dedicated today to Medicalchain, probably one of the most well-known startups when it comes to using this technology in the field of healthcare data management. Medicalchain has ambitious and challenging goals with a long-term vision because in fact it aims to create a decentralized healthcare system. How? Well, first of all, by putting the patient who owns their own health data at the center. Furthermore, since blockchain tracks all processes and does so in an almost immutable way, it also guarantees greater security and transparency, precisely to prevent possible healthcare fraud. Moreover, it has already been said that decentralization also means, or rather, above all, disintermediation. So, direct access to data leads to disintermediation and therefore less bureaucracy, and with less bureaucracy comes a reduction in costs as well. Then there are two rather interesting concepts, because Medicalchain actually has the ambition to create this platform which represents a sort of interoperable global healthcare system, meaning anyone from anywhere in the world. As long as there is a connection by accessing the Medicalchain platform, if needed, they can grant access to a healthcare provider to healthcare services and allow them to view their medical history. In this way, it also helps to reduce the possibility of medical errors. And finally, something that for us, especially for us Italians, is absolutely unthinkable. Medicalchain wants to create a decentralized market for health data, meaning your own health data. The patient can easily sell them to whom? To research institutions, hospitals, or even to a pharmaceutical company. How did the idea for Medicalchain come about? The two founders talk about it in a 2018 video, in which they basically discuss the same topics I've mentioned to you. Last time, in the previous video, I talked about the fact that patients who go from one hospital to another are discharged or maybe want to go to a hospital outside their region, outside their district, or even outside their country, since Medicalchain was founded in the UK, basically always had to carry their folder of medical records, their file, because it was very difficult otherwise. Thank you. The healthcare management systems of one institution rarely communicate with those of another, or with those of general practitioners, let alone with those of a foreign institution. And so, the two dedicated founders had meticulously created this innovative website called Lettera di Dimissione, which, as its very name profoundly suggests, was the comprehensive discharge letter from the hospital, where all the pertinent health data concerning a patient admitted for a specific medical issue could be thoroughly and efficiently summarized and easily accessed. And anyone who accessed this site, regardless of whether they were in a hospital in London, Nottingham, Manchester, or elsewhere, could basically find everything they needed in terms of that patient's health data. To talk about Medicalchain, it's important to consider the historical context in which it was born, which is 2018. A very particular year for this technology, because it was in 2018 that it really became famous, to the point that it could almost be considered a buzzword, similar to what's happening today with artificial intelligence. In other words, the term blockchain goes beyond just industry professionals or specialized magazines and starts to reach everyone. And so this mysterious technology, whose purpose isn't really clear, comes into play. Thank you. But it has to be applied to just about everything. Clearly, that's an unnecessary stretch. Perhaps the main reason why blockchain became so famous is that at the end of 2017, there was a major bull run. A Bitcoin run that went from a value in euros or dollars with 3 zeros to one with 4 zeros. So suddenly everyone became aware of Bitcoin and blockchain. And some strange notions also arise, which still persist today as beliefs, namely that blockchain is useful and important, while Bitcoin, not to mention other cryptocurrencies, is something negative and dangerous. Basically, blockchain and Bitcoin are two sides of the same coin. But let's set these considerations aside. Let's go back to the fact that in 2018, blockchain experienced a magical moment and many projects and startups were born. The way they finance themselves is by issuing tokens. Basically, these startups are initial coin offerings or ICOs. Tokens that are usually, though not always, produced by the Ethereum blockchain, and there's a rush by many people to buy these tokens purely for speculation, hoping that since these tokens are listed on exchanges, their value might increase because theoretically the project is worth something. So we're in a very speculative situation. And above all, we're in a situation that's a bit of a carbon copy of what happened in the late 1990s, the early 2000s with the dot-com bubble. That is, those startups that used the web, that were basically on the web. Many of these projects failed, and a lot of people, lost a ton of money. Then there were some projects, some startups that instead moved forward and changed history. Google, eBay, Amazon, and so on and so forth. But that's history. There's no need for me to tell it. In 2018, with the crypto world, we find ourselves in the same situation. Medicalchain is also an ICO, an initial coin offering, and in fact Medicalchain also has its own token, which has been listed and can be purchased. It's called the Medtoken, and it's a token that is produced on the Ethereum blockchain. And technically, it's a token known as ERC20. It belongs to this category. So, how does it work? Medicalchain? For those who watched episode number 5, video number 5, it shouldn't be too complicated to understand because the mechanism is practically the same. In any case, I think it's clear that Medicalchain uses two blockchains. One is a private, permissioned blockchain built with Hyperledger Fabric, which manages health data or at least access to health data. The other one, on the other hand, is Ethereum, which is mainly used to produce the MAD token, this ERC20 token. We'll see what these are used for in a moment. MAD token. The patient is the absolute protagonist of the situation, the owner of their own data. Where is the data? The crucial data is entirely outside the blockchain. It's completely off-chain and is securely stored precisely where it was produced and generated. So on the dedicated servers of large hospitals, specialized nursing homes, busy pharmacies, advanced labs, expert specialists, local clinics, general practitioners, and many other similar medical institutions and facilities. So the data is outside the blockchain, it's off-chain. This is mainly to comply with privacy regulations, which are the GDPR in Europe and HIPAA, spelled HIPAA, in the United States. So let's see what exactly is recorded on the blockchain. What is it that gets tracked? First of all, the unique identifiers of the patient who owns the medical record and of the professionals or entities who have requested access to it. So, permissions and authorizations to control who can access the health data. Therefore, there must also be an access log, that is the timestamp, the date and time when this access was made, and the type of access. That is, whether a professional accessed the medical record only in read mode or to modify or update it. Obviously, on the blockchain there must be the cryptographic image of the medical record, so there must be the hash, which changes every time the medical record is updated. But it's not just the hash that changes. The version of this health file also changes. This is recorded on the blockchain to have a sort of timeline, a historical memory of the changes. One last important thing, there must be pointers to the health files, that is, where the health files are located. So off-chain. Medicalchain has also developed an emergency access system to ensure patient safety at all times. Normally, the patient grants or revokes access to their own data, but in emergency situations and in cases of incapacity, it is necessary for doctors to have access to the patient's vital information, such as their first and last name, date of birth, emergency contacts, any illnesses they suffer from, the medications they use, any allergies, and decisions regarding certain treatment paths. So how does it work? It works by having the patient thoughtfully decide in advance which absolutely vital and critical medical information their attending doctors can safely access in urgent, emergency situations. If, for example, a sudden and unexpected emergency occurs, two authorized medical doctors can quickly scan the patient's specialized bracelet or other wearable device. And when both of these medical professionals give their explicit consent, secure access to this essential and life-saving vital information is then essentially and completely unlocked. Having access to this vital information does not mean having access to the entire history, medical history, the patient's entire medical record. In this way, both the patient's safety and privacy are ensured. Now let's look at the Medtoken issue, which is Medicalchain's token. It has already been mentioned that Medicalchain uses two blockchains: Hyperledger Fabric, where essentially all the management of health data takes place, including granting and revoking access to the patient's health data. And then there's Ethereum, which is used exclusively for the creation of these Medtokens, which are technically ERC20 tokens. The function of these tokens, the Medtokens, is fundamentally to interact with the medical sector in a decentralized way, to monetize your own health data, and to access services on the Medicalchain platform. Let me give a few examples of how Medtokens are used. The first is telemedicine. Telemedicine today is something quite well known, it's talked about a lot, and it's a hot topic in the healthcare field. But in 2018 it wasn't. So from this point of view, Medicalchain was a forerunner and a pioneer. At that time, payment to the doctor conducting the televisit and teleconsultation was made through Medtokens. Then there's something rather inconceivable for us Italians, namely the market for health data. The patient can, either in anonymized form or even in more detailed form, grant access to their health data to research institutions or even pharmaceutical companies for clinical research purposes. In exchange, they can be compensated with these Medtokens. Then there's integration with insurance companies. For example, the patient can receive a discount, a reduction on their annual insurance premium, or a reward in Medtokens when they participate in a program, for instance, a health program. Let me give an example. Weight loss for a patient like Toddy Keeley. We know that losing weight often means an improvement in one's health parameters. This improvement can be tracked and verified through Medicalchain when the patient grants access to the insurance company, which can then reduce the premium or reward the patient with Medtokens. Finally, Medtokens are also used to access other healthcare services on the Medicalchain platform. However, there is one issue that is still unclear to me. That is, how do Hyperledger Fabric and the Ethereum blockchain communicate with each other for the issuance of Medtokens? I looked for the answer both in the Medicalchain white paper and online, but I couldn't find it. So if anyone knows, please write it in the comments. Let me give you an example. At the end of a telemedicine visit, let's take the telemedicine visit as an example, the patient will pay the doctor with Medtokens. These Medtokens will be issued by the Ethereum blockchain, so there will need to be the activation of a smart contract to issue these Medtokens. Well, the very first thing that immediately comes to mind is that this particular something could potentially be an oracle or perhaps a bridge, which essentially and fundamentally tracks precisely what happens. I'm using very blunt and straightforward language here, on your Hyperledger blockchain network. Fabric, so granting the doctor access to the patient's health data, and so on. And at this point, the activation of the smart contract issues the Medtokens that will be used to pay for this telemedicine visit. If that's not the case, the alternative is that there is a central entity that manually activates this smart contract to issue the Medtokens via an API. It's clear that if this were the solution, part of the decentralized philosophy of Medicalchain would be lost. Let's move on to the issue of encryption. Medicalchain has 3 different encryption systems. Thank you. Let's start with the first one, the medical record. The medical record is encrypted using symmetric key cryptography. This means that the same key is used to both encrypt and decrypt the medical record. The symmetric key itself is then encrypted using a cryptography method called RSA. 2048 BT, RSA stands for Rivest, Shamir, Adelman, who are the inventors of this method. And it's an asymmetric dual-key cryptography, public and private, not to be confused with another asymmetric dual-key cryptography, which is instead based on elliptic curves, and it's more efficient than the one used in Bitcoin to sign transactions, which in fact is called ECDASA, that is elliptic curve digital signature algorithm. What happens when a doctor requests access to the medical record? We know that the medical record is protected by this symmetric key, a symmetric key that has encrypted the medical record. And so it is necessary for the doctor to also know this symmetric key. But at the moment, the symmetric key is protected by encryption using RSA cryptography with the patient's public key. So the patient takes their private key and decrypts the symmetric key. At this point, the doctor knows the symmetric key with which the medical record is encrypted, and in turn they go on to encrypt it with their own public key. Perhaps it would be more accurate to say that it's not really the doctor who encrypts the symmetric key with their public key, but rather the system that does it. After that, the doctor can decrypt the symmetric key with their private key. At this point, they know the symmetric key and can use it to decrypt access to the medical record they need to work on. But how do you revoke access for someone who, up until that moment, was authorized to access the medical record? Simply, the patient uses their private key to decrypt the symmetric key with the symmetric key. They access the medical record. At this point, a new symmetric key is requested to re-encrypt the medical record. And this unique symmetric encryption key will be encrypted with the distinct public keys of all the individuals who are fully authorized in order to access the sensitive medical record, except for the one whose access you want to revoke. It's a bit complicated, but you'll get there. Finally, the third type of encryption concerns the hash, which is recorded on the blockchain. Medicalchain is certainly a milestone when it comes to the use of blockchain technology in the healthcare field. It was born during a particular period, that of the ICOs, and it also features a token, so there was a lot of curiosity around it. It had an extremely attractive website, because in recent weeks it has become inaccessible. However, on the website, there were links to various videos which are still available. It seems to me that some of them are on YouTube, and likewise, on YouTube, you can find several interviews with the founder. Also with the technical lead, so there is still a lot of material available about Medicalchain. And indeed, it is a point of reference. It had a visionary, pioneering approach. As far as blockchain technology applied to this sector is concerned, there was a very interesting roadmap on the website. Just as the so-called Medicalchain issues were published, both on the website and on Medium, which were basically the various milestones of the project, that is, what had been achieved. Among other things, Medicalchain also managed to secure important collaborations with some major institutions, with some significant hospitals in the UK. And that's no small feat. And this could also concern us indirectly because, for those who don't know, the NHS, that is the National Health Service, the UK's national health system, is a beverage-type system based on public funding, and it's the model on which our own National Health Service was built. Before 1978, we had a Bismarck-type National Health Service, still public but based on the Mutual Insurance Fund system. So Medicalchain is definitely an important startup because, in my opinion, there is a before and after Medicalchain. Maybe I'm attached to it because it was the period when I started to study technology applied to the healthcare world in depth. And at that moment, Medicalchain arrived, which really shook things up. A very ambitious vision, a well-defined mission, and above all, most importantly, a robust white paper where the entire context was explained, the reason why it was necessary to tackle the problem with blockchain technology and decentralization. And in the white paper, we find an important descriptive section as well as a technical section. So, the discussion about cryptography is important. What exactly goes on the blockchain? And also the tokenomics. As I mentioned before, it doesn't exist. There isn't, as I said earlier, a connection between Hyperledger Fabric and Ethereum when it comes to the issuance of Medtokens. Moreover, Medicalchain had also developed a service within its telemedicine platform, which later became an independent project, and which, as far as I know, is still active, namely my clinic. We've reached the end of this rather detailed video, but the topic definitely deserved it. If you've made it this far, I thank you. Maybe give it a like, and if you're interested in these topics, subscribe to the Blockchain for Healthcare channel. See you next time. Goodbye.